The CDC Director Dr. Rochelle Walensky joins us right now. Good morning, Rochelle. How are you doing?
I'm well. Good morning, Nate. How are you?
Good. Now, as we just heard, some medical experts think that there should be a negative test requirement at the end of the 5-day isolation period. Why is that not required?
Yeah, really important question. So let me sort of go through the science that we were looking at as we were making these recommendations. First is watching the virus. How does the virus behave? And what we do know is about 85 to 90% of viral transmission happens in those first 5 days, which is why we really want people to stay home during that period of time and then mask for the rest of the time to capture that last 10 to 15%. We also know we're expecting a large number of cases. We've seen that in other countries, and many of those cases may be asymptomatic or mildly symptomatic. So we want to be able to get people back out if they're feeling well, but to also have them be masked. And finally, we want to make sure that when people isolate, to the extent that they can and are able to isolate, that they do so during that most infectious period, those first 5 days. To the question of why we didn't recommend an antigen test, first, we know a PCR test would not be viable because that PCR can stay positive for up to 12 weeks, for months and months. But for the antigen, this is a really important question, and that is because we don't know how this antigen performs with regard to predicting transmissibility towards the end of your period of infection. We know it performs really well during that period where you're initially infected, but the FDA has not at all looked at whether that correlate of your positive antigen really does correlate with whether you're transmissible or not. So with a negative antigen test, we'd still ask you to wear a mask. With a positive antigen test, we'd still say you could wear a mask. And since it wasn't going to make a difference in our recommendations, we did not recommend an antigen at that period of time.
I do have to ask you, there are so many places across this country where people just aren't wearing masks. Now you're asking them to wear masks. How do we get this across to people that, you know, if you've been exposed or you've tested positive, you still have to wear that mask for a certain period of time?
Right. Well, and that's actually a really important point, and that is we really do need people to follow these recommendations for them to work. But I would also say those people who are not masking, who are out and about, are probably not the ones who are isolating either. So what we really wanted to do is make sure that these recommendations were more easily followed. We shortened the time to encourage people to do the right thing, especially those who are infected. We don't want them out and about when they are maximally infectious.
Dr. Walensky, I want to get back to the rapid antigen testing for a second. If they were more readily available in this country, would you have included a testing requirement after that 5-day period?
So to be clear, we did not include a testing requirement in isolation because we were not clear. It was not clear what we would do with the information when we had it, and because the FDA has not authorized that antigen test for that use. We do absolutely recommend an antigen test in our quarantine recommendations for anybody who after they've been exposed at 5 days. So this really had nothing to do with supply. It had everything to do with knowing what we would do with the information when we got it.
Dr. Walensky, thank you so much for joining us.
Thanks for having me.